Hi, my name is Dr. Avi and I'm a dentist. In this video, I'm going to be talking to you about an associateship that I had a little over a year out of dental school. This whole series of my associateships are not meant to be me complaining or venting. It's meant to pull back the curtain on what dental associateships really look like in the real world. So you're watching part 6 of a series. If you haven't seen the first 5 videos about my first 5 jobs out of school, go back and watch them now and then come right back here. So I had just gotten let go from a practice where the owner gave me a 48-hour notice before he let me go. This sucked for obvious reasons. Luckily, I was still working at a Medicaid office for a couple days a week, so I wasn't fully unemployed. Remember how I told you before that it was a smart idea to be in multiple offices at once? Yeah, this saves me. I was able to just add a couple more days at the Medicaid job temporarily while I searched for a new opportunity. So for this next job, I was looking for an office that was private. I wanted a short commute, and I wanted a place where I could learn and grow and treat mostly adult patients. So I was playing tennis with my wife one day and I get a phone call. On the other end, it was a dentist who was interested in hiring me. I told him about my situation and what I was looking for in a practice. He told me that he thinks his practice checks all the boxes that I'm looking for. He mentioned that they were looking for a doctor to work 2 days during the week and every Saturday a month. Every Saturday? This guy could not be serious. He was actually serious. But I wasn't gonna let this be a barrier for me at least just seeing what the opportunity looked like. I figured I could talk to him about the every Saturday situation commitment at a later time. He offered for me to come in, see the practice, and so we set a date for the following Tuesday to come check it out. I went into the practice and this thing was massive. It was in a business building and it had like 20 different operatories. At the time, there were 3 dentists working and 10 hygienists. A real big operation. I toured the office. It was nice and clean. It had a real nice family vibe to it. I liked it. That day, the owner had me shadow him so I could see what a day looks like at the practice, and he said that he was even willing to mentor me. He was giving me tips while I shadowed him. I remember one of the things he told me to always be present with the patient, regardless of how much stress and chaos is going on in the practice. He told me to make sure that I build connections with patients, and this is the quickest way for them to trust me. I'm thinking to myself, wow, this guy's a solid mentor. I left the tour feeling pretty good. The only thing for me was this every Saturday commitment. It just wasn't gonna work for me. I was hoping that if they offered me the position, that we'd be able to come to some type of compromise. A couple days later, I get the call from the owner, and he was excited to offer me the job, but he stressed the importance of Saturdays. I told him that this was the first position I have ever heard of requiring every Saturday a month. For me, I valued my weekends. My wife was commuting to New York City for work. We really like to travel and explore and just rest on the weekends, like most people. He was super desperate to fill the position and he told me that he'd be willing to compromise and asked me if I could do 2 Saturdays a month. I only really wanted to give him 1 Saturday, but I caved and I agreed to 2 a month because I saw that this could be a pretty good opportunity for me. It would also allow me to work less days at the Medicaid office, so I was in. The daily guarantee was $700 a day, and I was getting paid on 30% of collections. My working days were going to be Tuesdays and Thursdays from 11 a.m. to 7 p.m. and 2 Saturdays a month from 8 a.m. to 3 p.m. This was a super unique position for me because it's the first time that I was working in such a big office. There were already so many established systems in place, so I did my best to ask questions throughout the day to ensure that I wouldn't be the bottleneck in everybody's workflow. I asked the front desk what information did they need from me to make treatment plans easier for them to talk about. I asked hygienists when they would like for me to come in for exams that would best suit the appointment. I also game planned different treatment setups with my assistants to make sure that when the time came, everybody was efficient, everybody was ready to go. This was my form of learning. Being a relatively new and young dentist, I really didn't have my style or preferences yet. I was very open and moldable. So the way that this office was structured, I had 2 operatories that I worked out of, but it was on the other side of the building compared to where the owner was working. So I didn't have a lot of day-to-day contact with him and I was kind of just on my own. He trusted me to do the dentistry that I wanted to do, so this was a lot of autonomy and I really liked this aspect. The other 2 associates that were working there were also super nice and helpful. I learned a lot from them. Overall, this practice was solid and I started to envision myself being there long term. Now, in a big practice like this, there were no assigned hygienists with doctors. Meaning when the hygienist needed a doctor for their exam, they would go around the practice and try to find the first available doctor. There would be anywhere from 8 to 10 hygienists working at a time and maybe only 2 to 3 doctors. This ratio was super steep. Normally, it's 1 hygienist to 1 doctor or at most 2 hygienists to 1 doctor. What happens when you have this many hygienist to doctor ratio, you end up having the dentist running around the practice, having to do multiple exams every hour. This causes less time for them to actually do treatment on patients and more time being spent in the hygiene rooms for exams. This can be a super stressful situation for a lot of dentists. Because I had my experience in Medicaid offices, I was able to manage being in 4 places at once. It wasn't ideal, but I was able to handle the stress. A bigger issue with having so many hygienists not assigned to doctors was that with this much crossover, it was really hard to keep track of treatment plans and things that I was diagnosing. I started to get a little concerned after a while when I noticed that a lot of the treatment that I was treatment planning wasn't being put on my schedule. If anything, it was stuff that was treatment planned by another dentist that was being put on my schedule. It turns out that the owner would treatment plan fillings on patients and then have the front desk schedule them with me. Now, I don't mind helping out other doctors with treatment. This was a problem for a few reasons. Some of the fillings that the owner was treatment planning on patients was treatment that I did not agree with. I would look at the x-rays and felt like some of those teeth that he treatment planned fillings on, I believe that the teeth would have been better served with crowns. This put me in a very tricky situation, because now I had to navigate a conversation with the patient in my chair and tell them essentially that I didn't agree with the treatment that the owner had diagnosed. And that in fact, I felt like a more expensive treatment option would be better served for the patient. So I framed this conversation with the patient by just being genuine. I told the patient every dentist does dentistry a little differently. That does not mean that one doctor is right and the other doctor is wrong. What it means is that every dentist has different skill sets and different perspective. This combines with their different levels of comfort with different procedures. In this scenario, I felt like the tooth would have been better served with the crown because I didn't think that we'd be able to get the isolation necessary for a filling to actually be successful long term. I also felt like there wasn't enough tooth structure to support just a filling. At the end of the day, the patient understood and went with the treatment that I recommended for them. Now, the situation of fillings being put on my schedule that I didn't treatment plan started to become more and more common. I asked the front desk, why are the owner's fillings being put on my schedule? And they said that they were instructed to do so by the owner. I asked the owner what was going on and why this was happening, and he said it's because his schedule was too busy, so he wasn't able to do these fillings, and saw that my schedule was empty, so he decided to give them to me. This made sense, and I appreciated the clarity. A couple more weeks go by, and I noticed that the crowns that I had been treatment planning in the bigger cases that I treatment planned just weren't being put on my schedule. And that was weird because I knew that I was treatment planning several of these cases. I asked the front desk again, hey, what's going on? And they said that they were instructed by the owner to place the crowns and the bigger treatment on his schedule before placing them on mine. How messed up is that? So the owner claimed that he was too busy to do fillings, so he put them on my schedule. But the reason why he was too busy is because he was taking the crowns and bigger treatment that I was doing and put them on his schedule. This was so twisted and it didn't make any sense to me. I confronted the owner about this and he said that he never instructed the front to do this. He also told me not to look at the treatment as mine or his, but as the office's. And he also told me that we were all working together to treat the patients. And he said that there was plenty of treatment to go around. It was clear that he was lying. And this was a story that he told himself to feel better about what he was doing. I chalked it up as one of the negatives to work here, but I sucked it up because I didn't really have another job option and I wasn't really trying to find another job at that time. This was my 6th job, a little over a year after school. Like I just kind of wanted to be in a spot. So after accepting this as my reality at the practice, I continued to push forward. The pandemic hit, so it gave me an opportunity to pause. I realized I was burning out on bread and butter dentistry. I wanted to learn more procedures that I could offer to my patients, things like implants and clear aligners. I also knew if I did more procedures that I could offer to patients, the owner couldn't steal them from me because he physically couldn't do these procedures. So I asked the owner if it'd be okay if I did an implant course. He said that he fully supported me taking the course and that investing in myself as a dentist was the best thing that I could do. I told him that the course that I was going to be signing up for was going to require me to miss a few Saturdays, and he said that wouldn't be a problem. I also got the green light to implement Invisalign in the practice. So I met with the local rep and I tried to onboard it into the practice. After I signed up for the implant course, a couple weeks go by. I was at home and I got a text from the owner. And on that text, he told me that I was no longer employed at that practice. And the main reason was because I was not working as many Saturdays as I originally committed to. He said that I was pulling away on those days and he really needed coverage. I tried to remind him that I wasn't working on a lot of those Saturdays because I was taking the implant course. which he approved prior to me signing up. So this was extremely confusing for me. He never responded to my texts or phone calls when I tried to get more clarity on this situation. But it was pretty clear that my time was done. This is how it ended. So let's assess this entire experience. It was good for the time being because I had a stable job and it wasn't that long of a commute. I was able to do bread and butter dentistry with full autonomy, and I also learned that owners will do whatever best suits them. What can you do to avoid this situation? Monitor the treatment that you're diagnosing and ensure it's being scheduled with you. Don't be afraid to speak up when you sense that things are going wrong in the office. This so-called model of sharing patients doesn't work. There is no way to ensure a fair distribution of patients. If you start to notice red flags in practice, you need to start looking for another job. If you take a course that's going to require you to miss some days at work, get it in writing from the owner that they are okay with these days being missed and that it won't affect your employment. Also, if you're ever going to own your own practice, don't treat people like this. You're employing human beings. Treat them like such. This whole series of my associateships are not meant to be me complaining or venting. It's meant to pull back the curtain on what dental associateships really look like in the real world. Many dentists that are small business owners simply aren't equipped to be business owners. They just aren't. They never learned a thing about how to actually run a business. So why would you expect them to be good at it? They all think they can figure it out on the fly and everything will be okay. There's no HR training, and this is one of the many reasons why there's such high turnover in the dental field. If you want employees to last more than a few months, change the way that you treat them and see what happens. I hope you enjoyed this video. Please drill that like and subscribe button and share this with anyone you think it may benefit. If you're wondering how my next job went, a spoiler is that I hit the eject button pretty quickly. I used past experiences to notice some red flags and got out when I could. Check out part 7 to find out. Thank you.